Good afternoon everyone, my name's Philippa Gardner. I'm from the Commissioner for Children and Young People's Office, and I'm very happy that you are able to join me this afternoon to talk about the Wellbeing Monitoring Framework which the Commissioner tabled in Parliament at the end of February. We'll be talking today primarily about the Wellbeing Monitoring Framework. The session today will go for about an hour, and I'll be providing you firstly with an overall look at the Wellbeing Monitoring Framework, some of the key findings of the framework, and how hopefully give you some examples of how the framework can be used in a practical sense. But I'd also like to talk to you about how you see the framework being helpful in your work, and hopefully we can talk amongst each other and have a bit of a facilitated discussion about that. I'd like to start with explaining a little bit about the role of the Commissioner for Children and Young People. The Commissioner was appointed at the end of 2007 for a 5-year term, and her work is very much directed by the Commissioner for Children and Young People's Act, and under her legislation she's got a requirement to look after the interests of children and young people as her first priority. The Commissioner for Children and Young People's Act requires that she has priority and special regard for Aboriginal children and young people, and children and young people who are vulnerable or disadvantaged for any reason. She's also required to give thought to the Convention of the Rights of the Child, and primarily her role is very much one of an advocacy and influencing role. So her intention is to work with the government, the not-for-profit sector and the private sector in terms of ensuring that government agencies and services that are provided in the community take into account the needs of children and young people. Before the Commissioner was established, it was very unusual for government agencies to really give a lot of thought to some of the specific needs of children and young people unless that was their primary mandate. But the Commissioner works a lot with government agencies to say, what are children and young people needing in relation to your services, and encouraging government agencies to look at the needs of young people in particular when they're planning and delivering services. I should say that the Commissioner is independent, so she doesn't have a minister that she responds to as such. She reports directly to Parliament, and there is a parliamentary subcommittee that she's required to report to on a regular basis. The Commissioner's primary responsibilities are to promote and monitor the wellbeing of children and young people in Western Australia, promote public awareness about the needs of children and young people, and she's also required to either conduct research, commission or sponsor or facilitate research into children and young people's wellbeing. And I hope that I'll demonstrate throughout the course of this presentation how the Wellbeing Monitoring Framework fits very neatly into those particular functions that she has. The Wellbeing Monitoring Framework itself was aimed at having an evidence-based, repeatable data collection that will enable us to have comparative data to see how Western Australians' children and young people were faring against those in other states, and where possible internationally. It was also important that the information that was provided in the Wellbeing Monitoring Framework is relevant in terms of making a practical difference. So we hope that the information is of practical benefit to people in terms of providing you with information that you'll find useful in the work that you're doing. In particular, the outcomes which are expected from the framework is that we hope that it provides you with information that will assist you in terms of advocating for the needs that children and young people have in your community, and supporting agencies in collaboration and improving service delivery. I think one of the findings of the Wellbeing Monitoring Framework and the information that comes out of that is that wellbeing is comprised of a number of interrelated factors, and it's not the responsibility of a single agency or a single organisation, but that people need to work together in order to improve the wellbeing of children and young people. There's also, I guess, within the Wellbeing Monitoring Framework, a consistent framework for the evaluation of programs and services, and provides opportunities to develop and expand on best practice models. What I mean by that is that as part of the work we did with the framework, we've conducted evaluations of programs that are already operating out there in Western Australia and elsewhere in Australia that have been proven to be improving or making a positive impact on the wellbeing of children and young people. And what we'd like organisations to do is, when they're looking at developing programs themselves, is to take into account programs that are already out there and effective. It's not quite as simple as just picking up a program and putting it in place in another region or in another area, but these programs are aimed at giving you some guidance and some starters about what has actually been proven to be effective in other locations. This in turn supports the principle of ensuring that evidence-based decision making is in place when we're looking at particularly developing policies and practices. It's rather than relying on anecdotal information or gut feel, but actually making decisions based on information which is collectible and reportable and can be definitively measured. So I'd like to talk to you a little bit about how we went about developing the framework. When we first started, identified the need for this program, we went about a lot of initial research and scoping. So there are a lot of frameworks out there already. Some of them are state-based, not West Australian, but in other states. We had a look at what other states and territories were doing, what was happening on a national level around for places such as the Australian Institute of Health and Welfare and ARACI. And taking that information, we collated and looked at whether there were some common themes or common measures or common areas across all of those frameworks that were already existing, and tried to take into account that and the unique needs of Western Australia when we were developing our own framework. The scope of the three reports is essentially that they follow the domains that were already been established by ARACI, and we basically have built on those ARACI domains in the development of our own framework. The framework is scoped by three reports, and I'm going to talk about those in a little bit more detail later. But we have firstly a profile of Western Australia's children and young people, which is primarily demographic data. We have the state of Western Australia's children and young people, which is a report of 33 measures of wellbeing and showing how WA children are comparing against those in other states. And we have the Building Blocks report, which, as I mentioned, is about programs that are already operating that have been evaluated as being effective in improving wellbeing in children and young people. And that's just a summary of the three components. So firstly, I'd like to talk about the profile. This is primarily administrative and survey data, and it's largely socio-demographic profile. Predominantly information's come from the Australian Bureau of Statistics, but we've also had some input from other government agencies as well. In this report, the focus is on population, diversity, social characteristics. So it's essentially, where are WA's children and young people? What are their age ranges? How do they sit in relation to the rest of the population of the state? What is their family composition, the types of schools they're going to? A whole range of, as I said, primarily demographic data. There's not a lot of analysis around that data, though we do provide some associated commentary. The second component of the framework is the state of WA's children and young people. This was really designed to incorporate measures of wellbeing for children and young people, and designed to be a resource for government, non-government and the private sector. In developing this work, we drew on existing frameworks from particularly Victoria and Tasmania, but we also looked at similar frameworks that were operating in other states. And we looked at the current research around wellbeing indicators to develop a long list of measures. When we first developed the framework, we ideally thought we would have about 20 measures of wellbeing. When we developed our long list, we had about 60 measures of wellbeing, so we needed to have a look at which ones of those were considered to be most important. When we looked at these measures, the criteria that we looked at for inclusion was how meaningful were these measures, and meaningful for researchers, for users, and as much as possible children and young people themselves. as much as possible, the information needed to be capable of disaggregation. And what I mean by that is we needed to break them down by gender, by Aboriginality and non-Aboriginality, and by region, differences between regional and metropolitan Western Australia. It was also important to us that the data was both consistent and repeatable. And what I mean by that is that we deliberately excluded from this report any one-off studies that were done. We wanted to be able to show time series analysis, so see whether Western Australia's performance over time was improving, deteriorating or remaining stable. That was important because we wanted to make sure that measures that we included in this report could be changed or were actionable by some form of intervention. In some cases we looked at the future as well. So we've included in the report some measures which might have only been conducted once or twice initially, but we know have got funding over the long term to have enough research to form a longitudinal study. For example, AEDI measures around children's preparedness to enter into the school system is a measure that we picked up under that criteria. Finally, and I've mentioned earlier, very important that our measures were capable of being influenced by action, whether that's within government or the private sector. In terms of paring down our list of the 60-odd long measures, we formed an expert reference group, and that comprised representatives from areas such as the Department of Health, the Department of Education, Department of Child Protection and the Department of Corrective Services. Some not-for-profit sector organisations, WACOS was part of our group, as was the Telethon Institute for Child Health Research, and we had the Australian Bureau of Statistics on board. We also invited membership from the Office of the Auditor General and the Ombudsman's Office, and we thought that that was important in terms of providing a balance and at a strategic level to ensure that there was some form of oversight in relation to the measures that we selected for final inclusion in the report. So in consultation with our reference group, we actually pared down our long list down to around about 26 measures. And then in the course of developing our work further, we recognised there were some additional measures, more for completeness in terms of the overall framework. So we've ended up with a final list of 33 measures, and those are included in the report. The next component of the Wellbeing Monitoring Framework is what we call our Building Blocks report. And the purpose of the Building Blocks report is to showcase programs that are aimed at improving wellbeing that have already been evaluated as being effective in this area. We didn't do the work ourselves in this office around that work. We had a contract with the Australian Institute of Family Studies, and they undertook that research for us and provided us back a list of programs that had been evaluated. In the course of doing that work, it became very clear to us that there are a number of programs that were out there within Western Australia that were working very well, but hadn't actually gone through an informal evaluation process. So unfortunately, they weren't able to be included in this report. However, in conjunction with the list of programs that we've provided, we've also provided some tools for organisations that we hope will help them conduct evaluation themselves. It is our intention that over time we develop another series of these reports, and we're hoping that we can pick up additional programs should we run a future series of the Building Blocks program. So it's really taken us a two-pronged approach around Building Blocks. It's about showcasing programs that have already been evaluated, but we're also hoping that agencies will take the opportunity to use some of the resources that we used in developing the Building Blocks report and apply that evaluation framework to their own programs. So, having given you a bit of an outline about these programs, about the three component reports, what I want to talk to you a little bit now about is the key findings. So firstly, in relation to the profile. The WA has the fastest population growth rate in Australia. And there are 540,000 children and young people in Western Australia. Now, children and young people in Western Australia, and my definition of that is people from birth through to 18 years of age. That's actually roughly a quarter of our state is made up of children and young people. 28% of children and young people live in regional and remote areas, and WA has one of the fastest growth of births. The number of births has actually increased by 24% in the last decade. What is also interesting in this report is about Aboriginal children and young people. So it's interesting that the proportion of children and young people in the Aboriginal population is almost double that of the total population. So 40.7% of the total Aboriginal population is younger than 18 years. 6% of children and young people overall in Western Australia are Aboriginal. And it's interesting that while, as I mentioned earlier, the metro to regional split is that 28% of children and young people live in regional WA, 2/3 of Aboriginal children and young people live in Western Australia, as opposed to 1/3 of that population that lives in metropolitan WA. We looked at some information about children with a disability, and nearly 7% of children from 0 to 15 years in WA are living with a disability or a long-term illness. Boys are more likely to fall into this category than girls. Roughly 1 in 10 children and young people in Western Australia were born overseas, and about the same number of that speak a language other than English as their main language at home. In terms of family composition, about 82% of children and young people are in couple families, and just over 17% are single parent families. In relation to the state of Western Australia's children and young people, I want to talk to you about some of the findings that came out of this report. There was both good news and bad news, but I want to start off by saying, in most of the case, Western Australian children and young people are performing as well, if not better, than their counterparts throughout Australia. There were some particularly encouraging findings, and that was in relation to smoking and alcohol consumption in pregnancy. And the statistics show that over time, the number of women smoking and consuming alcohol in pregnancy has fallen quite significantly, and particularly as WA is now performs better than the Australian average in relation to those statistics. Western Australia has the lowest rate of infant mortality across all Australian states, and in relation to preschool education, nearly 97% of children are enrolled in, are enrolled in the first pre-compulsory school year, and nearly 100% of children are enrolled in the pre-primary year. So that's a really, really pleasing result for this state. I should clarify with education, I'm talking about enrolment, which is slightly different to attendance, but I probably haven't got time to go into that today, but if you go in and look at the report, we've got some commentary around those figures. There was also encouraging findings around the youth justice area, and that is that very, very few children and young people come into contact with the youth justice system. What is also really pleasing is that WA performs very well in relation to participation, and by participation I mean the number of children and young people who undertake some form of sport or activity outside school hours. And it was very pleasing to note that around about 70% of children and young people undertake some form of cultural event or activity. So that was great. A further really good positive finding was around teenagers and the level of smoking in the community. And that has really significantly reduced over time, in that the percentage of children and young people who are smoking has dropped, so that now roughly only 6% of children and young people smoke. This same report, however, also identifies some areas of concern. particularly in relation to early childhood health and development. That's child health checks, immunisation and AEDI. Now, I'm conscious that I'm speaking to a regional audience and I'm about to talk about child health checks, and the information that was provided to us by the Department of Health was specifically about the metropolitan area. So I'm going to touch on that, but I'm not going to spend a lot of time talking about it because I suspect that the results are slightly different in regional Western Australia. However, in the metropolitan area, nearly all babies in the metropolitan area receive a first check from the child health nurse. So that's the first check with when the baby is first born, and generally that's the one conducted in the home. Less than half of those child health checks, though, are conducted within the optimum 10-day period. So while it's great that nearly all babies receive the check, there is scope for improvement in terms of the timeliness of that check. The 3 to 4 month visit also remains quite high, but after that the rates tend to drop quite sharply. In 2009-10, only 30% of eligible children actually attended the 18-month check, and then that rate dropped further to only 9% of children who attend the 3 to 3.5 year check. An interesting trend is also shown around immunisation, and that tends to follow a similar rate. In the immunisation rates tend to be higher for the earlier immunisation points and drop off as the child gets older. And WA has the lowest rate in Australia overall for child immunisation. Similarly, according to the Australian Early Development Index, which is the AEDI measure, almost 1 in 4 Western Australian children are developmentally vulnerable in the year that they start school. This means that Western Australia performs quite poorly in relation to the national average, and Aboriginal children in particular perform even lower than their non-Aboriginal counterparts. I mentioned earlier about alcohol consumption in pregnancy, and while there have been some pleasing trends in terms of reducing the amount of alcohol consumption in pregnancy, there is still nearly 50% of women who consume alcohol during pregnancy. Similarly, young people drinking alcohol, while it's slightly reduced over the last 10 years, overall the rates are still extremely high. In 2008, almost 60% of Western Australia's 12 to 15-year-olds and 80% of 16 to 17-year-olds reported that they had consumed alcohol in the past year. The same survey, which was conducted in 2008, and that's the most recent survey data we have available, 1 in 5 young people aged 12 to 15 years classifies themselves as a current drinker, which meant that they had drunk alcohol in the past week, and more than 1 in 3 16 and 17-year-olds were current drinkers. There's also evidence that the number of current drinkers drinking to levels considered risky to adults is increasing, and particularly for females. Other areas of concern are in relation to body weight, where approximately 25% of Western Australia's children and young people are considered overweight or obese, and therefore that means that they're exposed to a range of associated health risks, which includes asthma, cardiovascular disease and type 2 diabetes. In relation to mental health, one of the things that came out of this report is that there is a real dearth of robust data in this area. The Commissioner for Children and Young People conducted an inquiry into the mental health and wellbeing of children and young people in 2010. At the time that report was produced, there was limited data. However, there was a suggestion that services are currently only funded to provide a service to 20% of children and young people who actually require the service. So there seems to be an apparent gap between the number of people who need to use the service and who are able to access it. Similarly, with our NAPLAN results, WA has a smaller percentage of students achieving at or above the national standards for reading, writing and numeracy than most other states and territories. Our report has a swag of data about NAPLAN results, and I'm not going to talk about it in a great level of detail here, but if you are interested, I would encourage you to go into the report and have a look at the NAPLAN results in more detail. Homelessness was another area of concern. In 2010, around 8,400 children in Western Australia were members of homeless families. These were people who sought support from service providers. So we're aware that that number is not a complete picture of the number of children who are considered homeless, because we're only reporting in this figure on the numbers that have actually approached services for assistance. So we know there's a bit of a gap there. And significantly, nearly 45% of those children that approached service providers were aged between 0 to 4 years. And I think the importance of access to adequate and appropriate housing to children and young people can't be underestimated. Vitally important in terms of stability and the ability to establish social networks, attend regular educational opportunities, to participate in sporting events. So we see homelessness as an emerging issue facing this state. Of further particular concern was the gap between some of the measures in relation to Aboriginal children and young people compared to their non-Aboriginal counterparts. I think the information in this report confirms the ongoing disadvantage of Aboriginal children and young people across a range of wellbeing measures. This starts prior to birth even, where the incidence of smoking during pregnancy is significantly higher for Aboriginal women compared to non-Aboriginal women. So, by example, 51% of Aboriginal women identified that they smoked during pregnancy compared to 13% of non-Aboriginal women. Babies of Aboriginal mothers are more than twice as likely to be born at a low birth weight than babies born to non-Aboriginal mothers. The infant mortality rate is 2.5 times higher for Aboriginal babies than for all babies combined. Most Aboriginal children and young people are enrolled in pre-primary education, but they attend less regularly than their non-Aboriginal counterparts. And more than 1 in 2 Aboriginal children and young people are developmentally vulnerable when they enter school. Aboriginal children and young people are far more overrepresented in relation to requirement to be admitted to hospital in relation to injuries, and significantly overrepresented in terms of their contact with the justice system. Having said that, I don't want this to be a doom and gloom presentation, and so in conjunction with the report we have on statistics, we've also got our building blocks report, and that's really aimed at highlighting programs that have proved to be effective in that area. We've identified 82 programs under the same 8 ERACI domains that we use in the State of Western Australia's Children and Young People report. For example, we have a domain about education. The measures that we have that are associated with that domain is children developmentally vulnerable on entering school. And then we have a look at what programs we have that are out there in place already aimed at improving that. And a good example is the Wyndham Early Learning Centre. There's a lot more detail about the Early Learning Centre in the actual building blocks report, and I'm going to show you the website in a minute and walk you through how that works. So really the building blocks report is intended to be a companion report to the State of Western Australia's Children and Young People. So it's about what's being done proactively to help address some of the measures identified in that report. What I should say about the building blocks report is that while it's aimed to be a practical document, it's unfortunately not a shopping catalogue. It's not quite so simple to be able to just pick up a program and say that it's working in one area and know that with confidence put it in another area. What we're asking people to do is to look at the programs that are included in the Building Blocks report and make an assessment in terms of how suitable they might be for your region or your community. And perhaps it might need some adjustment, but it's to give you a bit of a starting point to look at what has already been successfully evaluated and what's already out there in relation to an area that you may have a concern in. I've mentioned earlier that we also provide an evaluation tool as part of this report to help you perhaps conduct evaluations of programs that you're aware that are already out there and are working effectively but may not have gone through a formal evaluation process. So, as I said, this is intended to be a very practical tool, and what we're hoping is that people will use the information in the 3 reports together to help them in their work. Just some examples of how the reports have been used already that we're aware of. In relation to our own work, the Commissioner for Children and Young People has developed a series of policy briefs. We've got 2 that have been published already, and we've got a further 3 that are very close to being published. And in the policy briefs that we've developed, we've got one in relation to youth justice and one in relation to early childhood. What we have done is looked at the measures specifically about those areas in the report, pulled them together to say what sort of a picture is this telling us about this area and the children and young people in Western Australia, and how it compares with their performance with children and young people in other states of Australia. We then look at what sort of programs are operating in those areas and whether these might be of value in terms of the impact that they're having on those measures. We're aware that the Office of the Auditor-General is currently undertaking what it calls a preliminary audit in relation to homelessness. And one of the areas that they particularly wanted to focus on in relation to homelessness was how that impacts on children and young people. And they've been able to use the Wellbeing Monitoring Framework State of Western Australia's Children and Young People report to get current data about approaches to services for homeless people, and also then looked at the Building Blocks report to get a sense of programs that might already be operating in Western Australia and have been evaluated and being successful. So in terms of their preliminary work and being of guidance to them in setting up how they're going to conduct the audit, the feedback we've had from them is that the report has been a really useful document. Similarly, the Office of Early Childhood and ERACI have also indicated that they're using the framework in similar ways. So what I wanted to do now is just walk you through our website and just show you where you can access the documents from. So I'm just clicking on the link to our website, and you can see that the Wellbeing Monitoring Framework actually has its own little standalone tab there, and if you click on that, that shows the 3 reports: the profile, the State of Western Australia's Children and Young People, and the Building Blocks report. So in the example that I mentioned to you earlier, if we click on the State of Western Australia's Children and Young People, what you'll see is that there's a number of domains there: health and safety, education, material wellbeing, family and peer relationships, participation, subjective wellbeing, behaviours and risks, and the environment. In relation to education, for example, if you click on this tab, when I can get the mouse to work properly, it gives you some information about the education domain. And we actually have 4 measures there, which is participation in pre-compulsory education, children developmentally vulnerable on entering school, students achieving at or above minimum standards, and pathways for leaving school. So what we've attempted to do within this domain is really cover education from before you start school through to the ways in which until you leave school. Now, if we click, for example, on participation in pre-compulsory education, what we get is some information about this measure and some commentary about this measure. We can also click on and bring up the actual data. If you go into the commentary section, and you have a link to see Table 1 in this particular case. Oops. Oh. And you'll see here that we show kindergarten and pre-primary enrolments for the years from 2005 to 2010. And you'll see that there's been a significant change in enrolments, particularly at the kindergarten level, and particularly in non-government schools during that time. If we then go into the building blocks program, or microsite, sorry, you'll see that that's structured under the same domains. So if we click into the education domain, it provides you again with some information about that domain and a range of best practice programs that are operating in the education sphere. Now, the one that I particularly talked about earlier was the Wyndham Early Learning Centre, and if you click on that, that actually brings you up some information about the Wyndham Early Learning Activity Centre, where it's located, a description of the program itself, who it's aimed at, what evaluation has been conducted, and some other useful information about other domains that might also be applicable to this particular program, resources and contact information, and references for further information. This microsite provides a summary of information which is on in the complete report. So if you want to get more information still, you can click and download the PDF for that particular program. And this is the extract which is taken from the full report. I mentioned earlier that we also provide information about evaluation tools, and if you click onto the About This report and further information, provides you with a list of appendices, and they provide you with a description of the components of best practice. So what do we mean about best practice? An outline of the methodology of identifying and describing best practice programs. Appendix 3 provides an evaluation tool, so what tool was used by us, and a swag of other information about how to conduct evaluations of programs and what is considered to be best practice in this field. So I've sort of shown you the real thing, so I'm going to gloss over those 3 slides a little bit. And really that's come to the end of my formal presentation. I'm going to put up my last slide now, which will provide you with the contact details for our office. And I'd encourage you to email us if you do have any questions, and we'd be happy to talk to you offline as well. Thank you very much for listening to the presentation today, and I hope you found it useful. Thank you.